February is American Heart Month, and we are focusing on the risk factors in this sponsored interview. Joining me now is the medical director for Optum, Dr. Gordon Harkness. Welcome to the show. This is important to talk about. How prevalent are heart conditions?
Yeah, with it being American Heart Month, this is a good time to talk about it. It's actually, with all the work we've done over the years to try to prevent heart disease, it's still one of the most common things. In fact, it's the #1 cause of death for both men and women.
Men and women.
Yeah, and even if you look across ethnic groups and racial groups, it's still a leading cause for most.
So I know we don't need this special occasion, but I mean, it's February, so we're talking about it because this is serious. 12 months out of the year. Are there key risk factors for heart disease?
Yeah, definitely. There's, things like smoking is an important risk factor. If you have a healthy lifestyle versus an unhealthy lifestyle, being active, those are important. High cholesterol levels can be a risk factor. The thing is, there are some risk factors you can't change, like family history and age.
Yeah, let's talk about some of the health conditions that can also increase your heart risk.
Probably the #1 thing here is diabetes. When you're talking about heart disease, anyone who has diabetes really needs to pay attention to that. Diabetes puts you at much higher risk, and so managing your diabetes helps with keeping the risk of heart disease down.
So what are some of the things we can do today to start preventing heart disease?
Yeah, there are things you can do that help to modify your risk factors. So living a healthy lifestyle, quitting smoking if you're a smoker, things like that. The American Heart Association, they talk about eat smart, move more, and be well.
So let's talk through a couple of those. What does eat smart mean when you break it down?
Yeah, a healthy diet, and I think most of us know what this means, but a diet that's full of vegetables, fruits, lean meats, lean proteins, healthy oils and fats, nuts, etc.
Doctor, we just had eclairs in the kitchen. You didn't mention those. Am I allowed?
I didn't mention those.
Am I allowed an eclair now and then?
There's no bad foods, but there's bad food choices.
There you go. What about moving more? How much?
Most people, for most people, it's recommended to put in 2.5 or more hours of moderate intensity exercise. What I like to tell my patients is most days you should be doing at least 30 minutes of some sort of moderate exercise.
That's a bite-sized portion.
Yeah.
I mean, 30 minutes, and that can be broken up during the day?
Yes, it definitely can.
Okay,
yeah.
That's good too. Maybe 15 minutes in the morning, 15 minutes at night. And then you say just be well.
Yes. These are healthy lifestyles. So getting adequate sleep, doing things to manage stress in your life, and developing good social connection with people. Those are all things that help with a healthy lifestyle.
I love that you mentioned that, because a lot of studies say that's #1. Now, that connection and reaching out to other people and what that does for your heart.
Yes, definitely makes a difference.
All right, so are there warning signs that you should look out for? Maybe things that signal you that you're in an elevated risk?
Yeah. For cardiovascular disease in general, there's two main things we want to watch out for, and that's heart attacks and strokes. When we're talking about heart attacks, I think most people know about the crushing chest pain, the pressure. If it's radiating towards the back or up into the neck or jaw, into the arms, also can be associated with shortness of breath, with nausea, cold sweats, those types of things. So any of those things would tip you off that maybe you need to get things checked out. And then as far as stroke, you're looking at things like numbness in the face, maybe speech changes, inability to speak, numbness or weakness on one half of the body or in one limb. These are all important things, and if you're experiencing this, you really ought to get evaluated right away.
Time is of the essence.
Yes.
When it comes to those.
Yes.
All right, what about screenings or tests that can help you know if you have a heart issue?
Yeah, they might be a little bit different for each person, individual person, but in general, most people should have their cholesterol checked, a lipid panel they call it, to kind of separate out the good and the bad cholesterol and understand your risks. Also glucose for sugar levels, since there's that connection with diabetes. And then blood pressure is very important. We can have elevated blood pressure and have no symptoms, and yet that puts you at higher risk for heart disease.
At what age should you start those tests and screenings?
It depends on the individuals. It depends on the other factors in their life. But most adults should have these screenings at least every few years.
If you've not had those, talk to your doctor.
Yes.
If you have questions, everybody, you can contact Optum. Optum.com/Utah. That's the website. You can also call the phone number that is on your screen, 801-982-3885. Optum always available for those questions. And thank you so much, doctor, for this sponsored interview. All right.